I first found out that I had cancer in late October. Oh boy.
It's okay.
I thought this would be easy. I'm sorry. Okay, I'll really be better. So I found out that I had cancer in late October, and I had actually gone to see my doctor because I had a blood clot. I thought it was a blood clot in my leg. And when I went to see her, she said that, you know, it looks like you have a blood clot, so we're going to go ahead and have you go to the emergency room. And at the hospital, they confirmed that I did have a minor blood clot, although, you know, it was very controllable, nothing major. But they also, because I had complained of a little bit of pain in my lower rib cage, below my rib cage, they did a CAT scan. And the results of that CAT scan of my chest and then a follow-up one of my abdomen indicated that I had ovarian cancer. And I needed to do additional testing to confirm that with a biopsy. The following Thursday, I began my first round of chemotherapy. That's a very standard approach for treating ovarian cancer, and we went through 3 rounds of chemotherapy. When I went back for my fourth round of chemotherapy, they had asked that we do a follow-up CAT scan just to see how the cancer was responding to the chemography. And I went in to get my chemotherapy, not overly excited about it because it's a little rough, but when we got there, she told me that my cancer was not responding to the chemotherapy, and so I wasn't going to have it. And I was devastated. It was really difficult. And we talked a little bit, and we talked about some of the treatment options at that point. And she talked about a couple trials that we could look at, but she also encouraged me to get a second opinion. At that point, it's really important to understand what the options are and to feel comfortable with the decisions that are made at that point. So I got 3 second opinions. I really wanted to understand what the options were. There was an event, though, that happened actually in the middle of December. A previous coworker from 20 years ago had actually shared with me that she had heard about a new physician in the Memphis area that provided this procedure called the HIPEC procedure. But she was very encouraging and said, go see him, go see what he has to say. And we listened very carefully to the recommendations of those physicians and did more research about the HIPEC procedure and wanted to pursue that further. I learned more. I learned that he was the first one in the Memphis area to actually perform this procedure. You know, I had to think about it a little bit because sometimes you want to go to a location, to a facility where they have lots and lots of experience. And although Dr. Munini had the experience, I knew that it was new to the area. So the whole surgical team, which is really important in this procedure, is something I needed to consider. But for me, I really wanted to bring this home, to bring it to Memphis, and to create the opportunity for others in our community to have this available to them. And here I am. As a project manager, I've always wanted to control everything. And this is something that I can't control. I can't control the disease. I you know, certainly wouldn't have written a project plan that said on this date this is going to happen. And there's a lot of ups and downs. There's a lot of surprises along the way. But I think the key to success is to understand that there's going to be twists and turns, but take control of it and really truly understand that as a woman, as a patient, you can help determine your treatment plan and be knowledgeable about the options that are out there and make decisions that are best for you and that are best for your family. And just continue to face each day, one treatment at a time, one day at a time is really the way to do that. one of the other key things for me in managing this is to get support. And obviously you've got your family and friends, but if you can find somebody who has been through this before, either ovarian cancer or another type of cancer, they are amazing in terms of the support that they provide. And they know what it's like when your hair starts to fall out or when you have to go sit in a dark room. And they can tell you, a dark room for the CAT scan, but they can tell you what to expect and really help you to get through each day. The HIPEC procedure is very tough. I'm going to say the word tough. And it basically, they will make an incision in my abdomen and they will take out as much cancer as they can. They'll do a total hysterectomy and they will spend a lot of time debulking and taking out all the cancer out of the peritoneal cavity. And once they have gotten just as much as they can, they will temporarily stitch that back up, but there'll be tubes still in my stomach and they will circulate heated chemotherapy in saline solution through my abdomen for probably about an hour and a half. And while they're doing that, they'll be swishing it around in there, taking a little, I don't know, sauna, warm bath. And basically trying to make contact with any remaining cancer cells that might be in there. And that direct application of the chemotherapy provides a tremendous opportunity to target the cancer versus the intravenous chemotherapy, which obviously works throughout your body, and there's a lot more side effects throughout your whole body versus targeting your abdomen and the cancer in your abdomen. I have learned a lot from the doctors as well as from research about what to expect both during the procedure and after the procedure. I know that when I come out of surgery, I'm going to be in ICU for probably a couple days, and I will have lots of tubes and that's okay. I know that after that I'll probably be in the hospital for 2 to 3 weeks because it is such an extensive surgery, and then following that there's a long recovery at home as well. So a total recovery time of anywhere from 3 to 6 months is what I'm expecting. I'm looking for 3 months. I feel like I'm healthy going into this. I'm not expecting any complications, and I'm looking forward to getting better soon. I just feel like that every step of the way has been guided, and as a project manager I always wanted to have that plan laid out, and I found life is really so much more fulfilling if you don't have everything laid out, and just take every day at a time, take all the hugs you can get and give them right back, and stay positive and know that it's not a journey that you're on alone.